Good morning viewers. Myself Dr. Abhinav Mehta from Ayurvedic and Panchkarma Center, Urban Estate, Phase 1, Jalandhar. In this video, we will talk about a skin disease which is chronic and often not treated properly by modern medicine. Psoriasis is an autoimmune disease which affects more than 1.2 billion people around the globe. Majority of patients are from cold regions. Normally, skin takes 28 to 30 days to shed skin from inner layer to outer layer. Epidermis is the outermost layer of skin, but in psoriasis, this process takes with 7 times more speed than normal. That is about in 3 to 4 days. And most of cells are immature and cells form psoriatic plaque and cells pile on each other. Nowadays, it is increasingly recognized as a serious disease with significant impact on emotional well-being and quality of life. According to modern system of medicine, the exact cause of psoriasis is unknown and is thought to be multifactorial, environmental and genetical. Weak immune system causes inflammation in psoriasis. When our body's defense mechanism goes wrong and attacks body's own cells, it occurs. Unhealthy hygienic and unhygienic lifestyle also contributes in its occurrence. Actually, T cells attacks healthy cells by mistake. This results in extra growth of skin cells. The main symptoms are dry, thick, silvery scales, dry and red patches, soreness, itching and burning around the patches, bleeding in the dry and cracked skin, rigged, pitted and thickened nails, small scaling spots in children, swelling and stiffness in joints. There are few types of psoriasis. One is plaque psoriasis. In this there is inflamed red skin covered with silvery and white scales with itching and burning sensation. Areas which are mostly affected in this are knees, elbow, lower back. Second is gutted psoriasis. It affects 2% of total psoriasis cases. It is characterized by small pitted spots on skin and is triggered by a streptococcal bacterial infection. Areas mostly affected are thighs, trunk, upper arms. Third is inverse psoriasis. It is mostly fungal infection results in this type. Symptoms get worsened with the sweating and rubbing of areas. These areas can be of armpits, buttocks, groin, under the breast. First is pustular psoriasis. In this, pus-filled blisters appear on hands, feet and associated with chills and severe itching and diarrhea. Fifth is erythrodermic psoriasis. It's least common but severe form of psoriasis may appear on whole body with intense itching and burning and rashes. The last form of psoriasis is scalp psoriasis. Most of patients mistake it for dandruff, but when dandruff treatment fails, then patients and doctor came to know that it was scalp psoriasis. In Ayurveda, we balances vitiated Vata and Kapha dosha and detoxify body with Panchkarma and immune boosters and immunomodulator medicines are administered. We correlate this psoriasis with Ketiva Kushta. Here stress also plays a major factor in aggravating the problem. Genetic predisposing is also seen. Most of the patients think that there is no permanent cure for psoriasis because they never got the right line of treatment. In Ayurveda, we administer Panchkarma to patients to detoxify the body with Mahatikta Grit or Panchtikta Grit, 50 ml for the first day, and each day we increase 50 ml more, and daily massages are done with special medicated oils. And after giving 250 ml on 5th or 6th day, we administer patient with Virechana medicine, and a series of loose motion, around 7 to 10 loose motion occurs, and this way the gut is detoxified, and after 15 days we again go for Vaman Chikitsa. Again, this is purification procedure through therapeutic vomitings. 50 ml of daily administering of Panchtikth or Mahatikth Grit for approximately 5 to 6 days, and when the Grit reaches the quantity of 250 ml on 5th or 6th day, we give medicine to induce vomitings. In this way, the vitiated kapha and expelled out of the body. In this way, body is detoxified for kapha. In most of the cases, patient get relieved in first 15 days of treatment. Approximately 30% of relief they feel. After Panchkarma for 2 to 3 months, patient had to take medicine for approximately 3 to 4 months more, so that psoriasis may not come back. This is a disease which increases with time and is very important to treat from very first stage. A normal skin shedding can also lead to serious psoriasis if not taken proper precautions at right time. Psoriasis can be result of three reasons, that is internal, external and mental too. And to cure permanently, we have to treat it internally and externally. One should take precautions and should follow good food regime as we guide to patients. I will share some home remedies which will help patients to get relief in psoriasis. The first is you have to take Indian lilac leaves plus aloe vera gel, turmeric powder and marigold flowers. The procedure is like this. We have to take sesame oil 100 ml and mix 100 ml of coconut oil in that. Cook it on light flame. Add 25 gram of Indian lilac leaves, that is neem leaves, and 25 grams of fresh aloe vera gel. And in this add 50 grams of yellow petals of marigold flower. Cook it for approximately 5 to 7 minutes on medium flame. Stop heating when oil is lukewarm and add 1 tablespoon of turmeric and 2 pinch of camphor in this oil, and cool it to room temperature and store it in glass bottle and use it daily on affected areas. And the second remedy is to prepare it from marigold yellow petals, turmeric and cow urine. We have to make a paste mixing all these in equal quantities and applying on affected areas daily for 2 to 3 hours. If patient will use this remedy regularly for one month, they'll definitely see a 25 to 30% of improvement per month. Due to the suppression of symptoms, the toxin revolving around the body may accumulate somewhere else and may form some other diseases. The major diseases may be these diseases can be autoimmune, other diseases like asthma, rheumatoid arthritis, even cancer may occur. Major side effects of allopathic medicines are suppression of natural cortisol production, and autoimmune responses can lead to severe diseases like cancers or tumors and skin cancers also. Skin thinning and resistance to treatment, dry and wrinkled skin, vision changes may occur, weakness of eye. Few things in food one should avoid are potatoes, tomatoes, brinjal, oranges, lemon, grapes, strawberry, red meat, mustard oil, milk products, sugar, alcohol, stimulating foods like beverages, teas, coffee, tobacco. At Ayurveda, we had successfully treated a number of cases of psoriasis, and we have proper literature and proper photographs of that. Thanks all for liking and sharing and supporting this video. Please don't forget to subscribe and share our YouTube channel.